I couldn't breathe, though my sets were not that bad, but I couldn't breathe, and I could feel that I was losing a lot of energy, and I was coughing a lot. So I couldn't eat. I couldn't do anything for myself. It was worse on the 5th day. I could feel that I'm losing. I can die anytime.
The hardest 2 weeks for outreach nurse Winky Mnqembisa. What started out as fatigue due to what she thought was work stress led to unbearable chest pains and shortness of breath. Mnqembisa drove herself to hospital, only to be told she had to wait for 6 hours in her car to see a doctor and to get a bed. Now a survivor, she still sticks to her daily medicine. Despite the challenges she faces as a frontline worker and the fear of contracting the virus again, Mnqembisa has some questions about the vaccine.
So I think it's good that the government is going to start with us, but I think before that, there's a whole controversy about the virus needs to be cleared.
A survey conducted by market research company Ipsos found that 64% of South Africans will get the vaccine when it's available. Residents in Nelson Mandela Bay Metro are of two minds about this.
I would take it because I don't want to sit in a position where if COVID should come into my house, then I'm like something bad happens. So I'm still considering, but I would.
I think I would wait a few months before I take the vaccine, per to say. If everything turns out well, I think I definitely would take the vaccine. But for the time being, the way the world is right now, with all the conflict in the US and all over the world, and especially in our country.
Oh, I go to take it, the vaccine, because of age. Because I've got no choice, I'm old, and this vaccine, they said, you start with us, Tina Bantu Badala.
Premier Oscar Mabuyane has allayed fears that the Eastern Cape will not have the capacity to roll out mass vaccinations. He also cautioned about the vaccine misinformation.
There are people who are recklessly spreading falsehoods about vaccine without any share of knowledge about vaccine, telling our people that they should not take a vaccine when it arrives. I think it is about time that our law enforcement looks into such people seriously because they pose a threat to the health of our people. Our people should trust government as the only credible authority on vaccine and the process that will be followed to roll it out. We will ensure that our staff are trained to achieve a rapid rollout of the vaccine. We will also work with all critical stakeholders to ensure the effective rollout of the vaccination program to stop the risk of a third wave.
The Health Department says over 67% of the population will be targeted in a phased rollout. This will begin with healthcare workers, followed by the elderly and those with comorbidities. Lerato Fekisi, SABC News, Port Elizabeth.
Right, well, earlier on we spoke to Professor Rufilo Masekela. She is the head of the Department of Pediatrics and Child Health at the University of KwaZulu-Natal, and we discussed vaccines and also how the new COVID-19 variant would impact children as they will be going back to school soon.
As the expansion period for the trials has started in the younger age groups. So the Astra Zeneca product, they have actually, it's registered for people over the age of 16. So for the adolescent age group, the 16 to 18-year-old age group would be covered by that. There's also other vaccines that there is now in the last week. They've started trialing it in younger children in the US between the age of 5 and 12. So the news is there hasn't been data out yet to show us the efficacy in younger children. But the good news is the trials are ongoing. They've already started enrolling in the US, for example, where they've now gone down to the younger age group, so we can see about the efficacy of these vaccines in children.
Right. So are vaccines typically first tested in adults before they're evaluated in children, or does the process vary depending on the disease?
Well, I think number one is remember, when we look at trialing medications, vaccines, for example, we usually do it in different phases. Okay, so phase one usually is done, once the drug has been tested in animals in the laboratory, then they would start testing it in healthy males, and then it would go on to either the target age group or the target group that's usually the vaccine is aimed at. But normally children would be last to be tested on any drug which has unknown efficacy or safety, because of course children are more vulnerable. So this is not an unusual situation. Children would normally be last to be tested for many drugs, right, because of concerns about the safety in younger children.
So these tests, these clinical trials, what will these studies likely need to look at? The number of doses and the interval between the doses, whether these elements needs to be adjusted for children perhaps, are those the areas you will look at?
Well, normally, if you look at drug and drug development, normally because children are growing and they have very different physiological dynamics when you compare them to adults. Normally in adults, you can usually give a standard dose that's independent of individuals. But in children, because they're growing and you get different weights and you get different age categories, usually drugs would then be tailored for different age groups, looking at specific dosing strategies. Of course, when the drug is normally first developed, they would do toxicity studies where they would give us increasingly high doses to see which doses are toxic, and that would be worked out in milligrams per kilogram. So it's a very complex but fairly simple procedure of working out what kind of dose then you would then try in the younger age group, because with younger children you'd have to work on different dose strategies, because it would probably be more related to the child's weight, unlike in adults where you could just use a single dose.
Prof, it's one thing to have a vaccine. It's another to convince parents to actually take their children to get it. With regards to this COVID-19 vaccine, are you getting a sense that people are now feeling more comfortable than they were, say, last year on vaccinating children?
Well, I think one of the key things in South Africa is, I think, in terms of vaccine hesitancy, those levels haven't been very high. But of course, there's a subgroup of parents and people who have this vaccine hesitancy. For whatever reason. Now, we've, for example, the immunizations that we have in our schedules currently have been around for many years, and many parents are quite willing to use these vaccines. And for the COVID-19 vaccine, I think the message is these drugs have been tested in the laboratory on animals to see if they're toxic. They've been tested in humans to see if they have efficacy. And by efficacy is we want to see whether the vaccine is robust enough to stimulate an immune response in the individual, so that when they're exposed to the virus, then the body can respond to it.
Right.
So from looking at the data in the adults, and now there have been a large number of individuals that have been vaccinated globally, there have been very, very minimal side effects. And the side effects that have been found in these vaccine, in the COVID-19 vaccines that have been given to individuals in the US, for example, and in Europe, are the normal ones that you'd expect with any vaccine that we give. You may have a little bit of redness at the site of the injection. You may have a little bit of tenderness. There may be a little bit of fever, but these are sorts of the side effects that we see with all the variety of vaccines that we have available, that we give to children millions of doses every year. Right. So I think people should be comforted to realize that there's no undue or unusual reactions that have been found, except for a few reports where people have had anaphylactic reactions. I think really it looks like from the number of doses that have been given globally, there have been very few unusual side effects. Right. So I would say to a parent that's concerned that from looking at what has already been given around the world, this vaccine does not seem to have any unusual side effects that we know of, and that it seems to be relatively safe to give in individuals, except for those people who have significant allergic reactions with other vaccines. That's really the only concern that's been cited in most of the guidelines around the world.